happy evening, a very good evening. I hope and I believe all of you are doing well. Please give me a quick nod whether I'm audible and visible to everyone. I think, yes, at least I can see myself, and you guys can give me a confirmation for the audio as well. So, we are resuming with the NF100 series. This is episode 36, and in this class, we are going to discuss the hypersensitivity reactions, the easy mnemonics for that. Why am I smiling is that because it is such a coincidence that just before this class, I received so many messages from the FMG students who have cleared their exam and acknowledging the value, the importance of this series of NF100, the mnemonics, the tricks, and the last minute revision series. So let me just show you some screenshots. You can see that I've just received them like 5 minutes back at 8 o'clock around, and you can see that the students have gained a lot out of the last minute revision series, the NF100 series that is going on, the mnemonics and the tricks, again the NF100 series. Then you have, I get such long messages, and trust me, these messages mean the world to me. Thank you so much, everyone, for having that faith in our work. And congratulations to all the students who've cleared the FMG. And for those who could not because of any reasons, please do not get disheartened. Remember, we are still there by your side. And till you reach your goal, till you reach your destination, Dr. Nikita is always there by your side. So we'll continue with the NF100 series, the mnemonics, right? The mnemonic of the day, the last minute revision, the KBMD episodes, and all of them. I'm sure that those are going to help you in your preparation as well. So I think the perfect time to resume with the NF100 series and a very, very important topic, that is the hypersensitivity reactions. And we'll see easy mnemonics to remember them. One question in the exam generally comes on this topic, and if we know this topic very, very well, then it becomes a cakewalk for us, right? So let's start with it. Before that, let me tell you what's the plan for the next 3 days, the upcoming days. So on 30th, we have the 5 p.m. class on the app, and we have the series of free live classes tomorrow on the app, Harrison-based important topics. And I'll be taking important radiology images from Harrison's, maybe predominantly focusing on the chest radiology. So based on, what are the important images that are given in Harrison's, what is written below the images, that frequently is asked in the exam. So tomorrow we will have Harrison's based radiology discussion. 31st, again, we'll have the next episode of NF100. And a very, very important topic is what we are going to try to decode with the mnemonics. The PM lividity ke color ke mnemonics, right? A very, very important table in FMT. And based on the color, we are asked to identify the poison. So we will do PM lividity color ke mnemonics in the next NF100, day after tomorrow. And then finally, the new year coming up. First, we will have a YouTube session at 1:30 p.m. where we are going to talk about the new year and the new you motivation, right? So it's gonna be some motivational pep talk to get a kickstart for the year 2022. That's gonna be there at 1:30 p.m. And then from 1st to 5th of Jan, we are also going to have the free live classes on the app every day at 5 p.m. a routine type. And what is going to be that series or those sessions? That is still a surprise. I'll let you know in a day or two. What series, what sessions are we planning for 1st to 5th of January? Of course, something which is going to help you again. Okay. And before I forget, let me tell you that we have started with new batches for the FMG students who are going to attempt 2022 exam, and also NEET PG students, the MCQ discussion batch. Both these batches are going to help you in the preparation. So this we have started today itself. So if you have failed to enroll this and you think that you need a push to your preparation, you can enroll for these batches. And the best thing that before I forget to tell you, it's just tonight you have this offer where you'll get extended subscription. If you take minimum of 6 months, you'll get extra month subscription. You can use the code Dr. Nikita to get extra discount while you are subscribing. Now, having said that, let's start with today's class. And yes, the test series is also something that you should make the best of it. You have a lot of free tests coming up on the platform. All right. So starting with the hypersensitivity, NF100 is for NEET PG 2022. Absolutely it is. Now again, if I have students here who have queries, that is NF100 specific for FMG students? No. Like I say that this NF100 is the core of your preparation of any exam. Be it your FMG exam, be it your NEET PG exam, or be it your INICT exam. So NF100 is the core important topics that every medical graduate should know for any exam, right? Okay. So let's start with the mnemonics for the hypersensitivity reactions. So we have the famous mnemonic that is acid, that is type 1, type 2, type 3, and type 4. So anytime we tend to get confused what is type 1, 2, 3, and 4. So remember the mnemonic acid. That means type 1 is anaphylaxis. Okay, or type 1 is allergy. Anaphylaxis, allergy. A. What does C stand for? C means cytotoxic. I means immune complex mediated. Immune complex mediated. And D means delayed hypersensitivity. Okay, delayed hypersensitivity. We can also remember this hypersensitivity reactions with the other mnemonic that is A, B, C, D. A remains the same, that is anaphylaxis, allergy. B stands for antibody mediated, that is B is antibody mediated. So antibody causing the cell death, that is cytotoxic in that sense. It is not your T cell wala, it is your antibody mediated cytotoxicity. Okay, remember that point, very, very important. And C stands for immune complex or your complement mediated. So immune complex, usko complement bind hota hai. So complement plays a role in type 3. And D again is delayed hypersensitivity. So remember, both these mnemonics are important. Sometimes you'll be asked antibody mediated kaun sa hai, sometimes you'll be asked complement किस में होता है. So that is acid and ABCD. Now, which antibody plays a role in type 1 hypersensitivity reaction? Which antibody plays a role in type 1 hypersensitivity? Anaphylaxis, allergy, it is your IgE, right? Again, an important question there. Which of these hypersensitivity reaction is basically cell mediated? Delayed wala is what is called as cell mediated hypersensitivity. Okay, it's your T cell, it is your cell mediated hypersensitivity, which has your granuloma formation as well, which takes part. All of that we'll be seeing. Okay, so remember that basically 1, 2, 3 are predominantly antibody mediated, be it IgE, be it other antibody, or be it immune complex. While your type 4 is cell mediated. Okay, type 4 is cell mediated. So remember acid and ABCD. Now going to each hypersensitivity reaction, type 1, 2, 3 and 4. Absolutely right, Srashti. That was recent mnemonic of the day. Interferon gamma for granuloma formation. Now the mnemonic for your type 1 hypersensitivity reaction. Remember 1 matlab first alphabet A. So all the A's coming in your type 1. And remember a pact. So 1 is, the mnemonic for 1 is A, pact. A stands for allergy, anaphylaxis, asthma, atopy. Atopy means allergy running in families, right? So allergy, be it allergic dermatitis, be it allergic conjunctivitis, anything which is allergic. So allergy, anaphylaxis, asthma and atopy. The A's are first alphabet, it is type 1. Pact is your PK reaction, the Prosness-Kursner reaction, which basically tests for which immunoglobulin? That is IgE in the skin. Okay. Then you have the A, packed में all these A's. C for Cassoni test. Cassoni test is a test for hydatid, right? It's a test for hydatid. Nobody does it now, but we need to know it for a theory purpose. And then you have T, which is Theobald-Smith phenomenon, which is nothing but previously anaphylaxis, which is now called anaphylaxis. Previously, it was Theobald-Smith phenomenon. Okay. So remember, the mnemonic for type 1 is A, pact. Okay, that is A, pact. Clear with everyone? Right, that's your type 1 hypersensitivity reaction. The next one, type 2, which is basically antibody mediated, right? It is antibody mediated cytotoxic. So the mnemonic is I push to gear. Okay. So this mnemonic basically for type 2 is I push to gear. That means to increase my speed, maybe of studying, maybe of going anywhere, I push 2 gear. So I for insulin dependent diabetes mellitus, because we know that is where you have the role of antibody. Can someone tell me what antibody do we have in IDDM? I think we have seen this in one of our KBMD episodes or the previous special classes. कौन सी antibody होती है IDDM में? Very good, Dr. Matan. Absolutely right. That is your anti-GAD antibody, right? Glutamic acid decarboxylase, GAD antibody. So it's antibody mediated. Immune, matlab antibody mediated. So be it immune hemolytic anemia, be it immune thrombocytopenic purpura, ITP, autoimmune disorders, right? They come under your type 2. Push ka P, that is pernicious anemia and pemphigus vulgaris. 2 matlab this is type 2 hypersensitivity reaction. Gear matlab G for Graves, G for Gravis, myasthenia gravis and Graves disease. E for erythroblastosis fetalis, that is your blood wala reaction, so even the blood transfusion reactions. A is autoimmune disorders or immune disorders like hemolytic anemia or ITP, and R stands for rheumatic fever, RH, rheumatic fever or rheumatic heart disease, and even RH incompatibility. Okay, and even RH incompatibility. So your mnemonic for type 2 is I push 2 gear. That is immune disorders, insulin dependent diabetes mellitus, pernicious anemia, pemphigus. 2 matlab type 2. To help you remember, this is the mnemonic for type 2, and you have gear, that is Graves, myasthenia gravis, erythroblastosis, and blood transfusion reactions. Then you have autoimmune disorders, hemolytic ITP, R for RH incompatibility, and rheumatic fever or rheumatic heart disease. Remember, it's not rheumatoid arthritis or reactive arthritis here. Okay, there is no arthritis here. Okay, there's no arthritis here. That will come in your type 3. Going to the mnemonic for your type 3 hypersensitivity reaction. For type 3 hypersensitivity, the mnemonic is sharp. Okay, the mnemonic is sharp. So remember, 3 is sharp. Okay, type 3 is basically sharp. So you have S for SLE, which is basically a combination of 2 and 3. SLE is a combination of 2 and 3, more so 3. Then you have serum sickness, H for HSP, Hinod Schonlin purpura. Hypersensitivity pneumonitis, again, which is a combination of 3 and 4. A for Arthus. What is Arthus reaction? It's a localized immune complex deposition. When it's diffuse, it is serum sickness. When it's localized, it is Arthus. R for Arthus के साथ याद रखना arthritis. The reactive arthritis and the rheumatoid arthritis. Rheumatoid again is a combination of 3 and 4. And then you have P for PAN, polyarthritis nodosa, and post-streptococcal glomerulonephritis. Can you tell me at least one very, very important disorder that we need to know which is associated with PAN? Which disease patients are at a risk of developing PAN, polyarthritis nodosa? What background history do you generally have? Very good. That is your hepatitis B. Okay, that is hepatitis B. Very, very important. Another important question on PAN. PAN में which artery is never involved? Remember PAN, the mnemonic is PAN. It is polyarthritis, that is pulmonary artery, never involved. Remember, it does not involve pulmonary artery. Coronary nahi. Coronary it can involve, Ashish. It is the pulmonary which is not involved. Okay, pulmonary artery. It is PAN is pulmonary artery not involved. So everyone clear with the mnemonic for type 3 is sharp, SLE, serum, HSP, and hypersensitivity pneumonitis, Arthur's reaction, arthritis, reactive and rheumatoid. And we have your P for PAN and P for PSGN. Okay, PSGN. Next one, coming to your mnemonic for type 4 hypersensitivity reaction. So type 4 is cell mediated, right? There's a role of CD4, the helper T cells. You have your epithelioid cells, the macrophages turning to epithelioid, forming your granuloma. And mnemonic of the day, we saw the interleukin. Interferon gamma, gamma forms your granuloma, right? Gamma is what helps, interferon gamma is what helps in granuloma formation. So for type 4, remember the mnemonic is, imagine someone getting a skin graft. So you contacted something which damaged your skin and then you got a skin graft done. So contact skin graft. Graft ka GRA or graft ka GRA ka granuloma, GRA. Okay, so remember you contacted something which damaged your skin and got a skin graft done. So skin, contact, graft and granuloma. So the skin test, basically which skin test? The tuberculin test, the Lepra test, the Montegro test which is done for leishmania. All of these are basically your type 4. Cell-mediated contact go hand in hand. So remember, contact dermatitis is cell-mediated type 4. Allergic dermatitis, A is type 1. Contact dermatitis is cell-mediated, it is type 4. Very, very important, asked even in your INI-CT exam. D for the chronic graft versus host disease. It is a combination of both 2 and 4. If you want to choose one, go with your type 4. And then you have all the granuloma forming disorders, be it TB, be it sarcoid, be it Crohn's disease. Basically anything and everything which has granuloma, that is your type 4. Remember, contact, skin, graft and granuloma, that is your type 4. Now, what is type 5? Something new in the hypersensitivity reactions is your type 5 hypersensitivity reaction. Basically, where there is antibody to a receptor. Okay, antibody to a receptor. So, you have the two grave things here. Okay, two grave things. Graves and myasthenia gravis. Ideally, where did we see this? Two disorders in which hypersensitivity reaction. In our mnemonic, where did we see Graves and myasthenia gravis? It is antibody. Body is B. That was your type 2. So these two disorders from type 2 have been moved to type 5. Okay, type 5. Type 1 mein. Type 1 ka mnemonic was a pact. There's no G there. This was in your gear. I push to gear. G for Graves, G for myasthenia gravis. Right? So type 2 antibody was antibody against a receptor. Like you have in Graves, the antibody against TSH receptor. In your myasthenia gravis, we have antibody against acetylcholine receptor, right? So that is your receptor, antibodies against receptor. So Graves and myasthenia gravis is type 5. All right. Now there are few disorders which are a combination of the hypersensitivity reactions, like SLE is both the type 2 and type 3 hypersensitivity reaction. Right? We saw in your sharp, the mnemonic for type 3 was sharp. There it was SLE, serum sickness, HSP, hypersensitivity pneumonitis, Arthur's reaction, arthritis, reactive rheumatoid pan, and PSGN. So SLE is a combination of both antibody and immune complex, 2 and 3 both. Okay. Rheumatoid arthritis, hypersensitivity pneumonitis, basically in your mnemonic sharp. It's again a combination of 3 and 4. Okay, rheumatoid arthritis is both 3 and 4. Transplant rejection. The favorite question in transplant rejection is hyperacute transplant rejection is what type of hypersensitivity reaction? Remember, it is type 2. Okay, that is type 2. Because hyperacute, तो मतलब antibody mediated, मतलब body में already antibodies है which are acting against the graft, that is preformed antibodies, right? So basically it is due to preformed antibodies, and antibodies is type 2. So hyperacute, remember, is your type 2. Remember, hyperacute is 2 words, hyper and acute, it is type 2. While acute and chronic can be both, they can be 2 and 4 both. Okay, acute and chronic can be both 2 and 4. So that is for acute and chronic. If you want to go for one, chronic is like delayed, so it is type 4, and acute is like type 2. Okay, if you have to choose one. So yes, Srishti, if you have in the options for Graves and myasthenia gravis, in one of the options you have type 5 which is there. That means the examiner is testing you on this update in the classification. So if you have both 2 and 5 in the options, then go for 5 for Graves and myasthenia gravis. If you do not have the option of type 5, that means it's taken from a previous question bank, then you should go for type 2. Okay, so that basically depends on the options that you have in the exam. Is this clear with everyone? Right? Going to the next one, that is Lepra reaction. What is the Lepra reaction ka rule? Remember, Lepra is 5 words, 5 letters, 1, 2, 3, 4, 5. So it has the rule of 5. That means type 1 is type 4 hypersensitivity reaction. That means 1 plus 4 is equal to 5. Type 2 is 2 plus 3 is equal to 5. So basically you have the rule of 5 for Lepra. Remember Lepra, Lepra. So it has 5 letters. So rule of 5. 1 is type 4 hypersensitivity reaction and 2 is type 3 hypersensitivity reaction. Okay. So that is for your Lepra, right? 1 plus 4 and 2 plus 3. Absolutely right. So those were the quick mnemonics on the hypersensitivity reactions. Let us quickly see on all the mnemonics that we have seen. First, we saw the mnemonic acid and ABCD. That is anaphylaxis, cytotoxic, immune complex delayed. Anaphylaxis, antibody mediated, complement mediated and delayed. Then you saw the mnemonic for type 1 is A packed, right? The mnemonic for type 1. Just give me a minute. All right. So the mnemonic for type 1 was A packed. That means anaphylaxis, allergy, atopy, asthma. P for PK reaction. A for all the A's. C for Cassoni and T for Theobald-Smith phenomenon. Type 2 ka mnemonic is I push to gear, right, to increase my speed. I is insulin dependent diabetes mellitus, immune reactions like immune hemolytic anemia, ITP. P is your pernicious pemphigus, 2 is your type 2, G is Graves and Graves, myasthenia, erythroblastosis fetalis or blood transfusion reaction. What was A here? In your type 2, what was A? Autoimmune like hemolytic anemia or thrombocytopenic purpura. R was for not the arthritis, RH wala. Okay, it is your RH wala. RH incompatibility, rheumatic fever or rheumatic heart disease. Type 3 ka mnemonic is sharp, right? SLE, serum sickness, HSP or hypersensitivity pneumonitis. A for arthus, R for arthritis, arthus and arthritis, reactive and rheumatoid. P for PAN and P for PSGN. Then you have type 4, that is your skin contact and leading to graft or granuloma, right? Graft granuloma. So you have skin test, that is your TB, tuberculin test, lepromin test, Montegro test, contact dermatitis, chronic graft versus host disease and all the granuloma vale disorders. Okay. And type 5 is the one which we saw is your receptor mediated, that is Graves or Graves, myasthenia gravis or Graves disease. And the first mnemonic we saw was acid and ABCD. So these are all the mnemonics that we have seen on hypersensitivity reactions. I hope this topic is now easy and you will remember all the types of hypersensitivity reactions. Just to add to the list, Lepra reaction is your rule of 5. 1 plus 4 and 2 plus 3. So 1 is type 4 and 2 is type 3. Okay. So that is your Lepra reaction. Okay, that's your Lepra reaction. So yes, guys, that was about today's hypersensitivity reactions mnemonics. When are we meeting next? We are meeting tomorrow on the app for a free live class at 5 p.m. Harrison's based important radiology images, which are very, very frequently asked in the exam. How can the questions be asked and what are all the images that you should be knowing from Harrison's? It's going to be mixed bag because it's based on Harrison's. That is why I think those are the must to know images in radiology. So we'll have mixed bag that we'll pick up and it will be like a quiz sort of thing that we will have. And so there's going to be a live poll and there's going to be a leaderboard. So hoping to see you all tomorrow at 5 p.m. on the app. The next NF100 is going to be on mnemonics for PM lividity, forensic medicine on the YouTube channel. And then on first, we will have the new year and new you motivation at 1:30 p.m. Okay? Diabetes mellitus type 1 is type 2, right? Because it has antibody, the GAD antibody. Okay. So thank you so much everyone for joining in and please do solve MCQs on hypersensitivity reactions to develop your confidence in this topic and to develop your MCQ solving skills as well, and that will serve like a revision as well. Okay? Thank you so much and goodbye. Take care. Keep studying, keep revising and keep winning. Thank you so much.